Welcome back to the STL Medical Weight Loss Show. I'm your host, Dr. Joseph Moleski. Here we like to talk about things that really do matter to hopefully change our patients' lives. And I wanted to get into a few things. I know we talked a little bit about food cravings. We talked about, essentially getting your weight down, getting your confidence back, and, talking about little health hacks or health tips that you can do. Simple exercise, walking right after a meal makes it very simple to reduce your glucose spike and reduce your insulin resistance. These are little tips and hacks that my wife shared earlier. And so I wanted to kind of segue that into talking about metabolic syndrome. So when we talk about metabolic syndrome, what is that? Like, Dr. Moleski, that's great. That's a cool word, but what is that? So that talks about having the diagnosis of increased waist circumference, increased triglycerides or increased cholesterol, high blood pressure, and then having that elevated blood sugar or fasting blood sugar or prediabetes. And so when we look at somebody that has metabolic syndrome, they have an issue with their liver. And the reason I bring this up is because so many Americans were stressed, were, grabbing the quickest thing to eat, and a lot of the times it's riddled with sugar. And what happens is when you consume sugar, that sugar molecule is composed of two things. And I'm just making this simple: glucose and fructose. And so fructose, what it can do is it's highly addictive. And what it can do is it goes in your liver and it turns into a substance called methylglyoxal. And that's a long word, but that substance then starts generating fat, and it starts generating the formation of cholesterol in your liver, and then it also triggers your liver to make glucose or sugar. So the sugar is making your liver make more sugar and make more fat, and then it's starting to build those cholesterol molecules. And so what happens is you're getting the sugar that you're consuming, and then it's causing your cholesterol numbers to rise, your insulin resistance to rise, your blood sugar to rise. That's putting on weight, and then that's making you feel crummy during the day. That's making you feel wow, like I have a crash. Like, all right, I'm going to eat some sugar, feel good, I have a little caffeine there, and then 3 hours later I get a crash. And so a quick and dirty thing that I like to tell patients, they ask, how do I know if I'm insulin resistant? We can do, blood tests, lab tests. Sure, we can look at your cholesterol, we can look at your triglycerides, we can look at your fasting insulin, we can look at a fasting blood sugar. We can do all those things, but a quick and dirty way to do it is just stand up, look down, and do you have any weight around your hips, thighs, abdomen? Any excess weight around your hip, thighs, abdomen? You're probably, not all the time, insulin resistant. And so I had a patient that she was starting with us, and she wanted to get some baseline labs, and we're happy to do that. So I got some baseline labs through LabCorp, and I was discussing with her yesterday on her results. And so it showed that she was pre-diabetic, which she didn't know about. So pre-diabetes means that your fasting blood sugar, like when you wake up in the morning, is above 100, and that A1C number is above 6.4 or 6.5. So she was pre-diabetic, and then what did I see? I scrolled through her list, and sure enough, her cholesterol was elevated. At the time, she didn't have elevated blood pressure, but it showed that she was having issues with her blood sugar and her cholesterol. What did I just talk about? I just talked about how consuming sugar causes, the breakdown of sugar into fructose. It causes methylglyoxal. That causes almost like a poison in your liver, and it creates increased sugar and increased cholesterol. So the liver, folks, is a big issue. It can become a big issue when you're consuming lots of highly processed foods and sugar. And so I always recommend, and I've said this in previous segments, look in the back of your nutrition facts label. It should say added sugar. If it's greater than like 1 to 2 grams and it doesn't have a lot of protein in it and not a lot of fiber, I wouldn't eat it. I mean, real simple, just don't eat it. We like to keep the grams of sugar daily in men. They say 35 grams. I say keep it less than 10. Females, 25. I say less than 10. And try to keep those added sugars out of your diet, because it's essentially going into your liver, causing insulin resistance, and it's literally causing you to hibernate. So it's literally just saying, okay, well, I'm good. Dr. Joe, man, he's eating sugar and he's good. He doesn't need to lose weight. He has lots of food around. He doesn't have to lose any weight. I mean, and for any client, it can keep weight on. And so these medications, what they do is they work in the liver and pancreas. They reduce your insulin resistance, and then they are able to jumpstart your metabolism. They also work in your GI tract, where they slow down digestion, they make you feel fuller longer, and then they work in your brain to help with food cravings. Very simple, but very, very effective, and it really is what people need to get to that next step, to get to that next weight goal, to jumpstart their weight loss, even though they might be already doing lots of things like CrossFit in the morning, they're going to the gym all the time, going to a high intensity workout. This complements what you're already doing, and I love to see patients get their confidence back and feel like, wow, like Dr. Moleski, what you're doing for me, this is actually working, and like I'm happy. And I see a lot of patients improve their mood once they get even down the first 10 pounds. And so I highly recommend, if you know a family member or a friend or anybody interested in losing even 10 pounds, give us a call. We're always happy to chat. We do personalized, customized weight loss assessments. We're happy to draw blood work for you if you're interested. We're happy to help you with anything you may have questions with. Please don't hesitate to contact us. The best way is book an appointment, STL or you can call us for a free consultation, 636-628-6604 for more information. We'd be happy to chat with you.